Here's my audience. Hello, my name is Gabrielle Sleben, and my persuasive speech is on why healthcare needs to be more affordable. Have you or anybody you know postponed treating medical care because of financial issues? I know I have. Just recently I lost my insurance and I had to pick between paying a $500 bill to see my OBGYN or to lose access to my birth control, which every woman should be able to have access to. And today I'm going to tell you why healthcare needs to be more affordable. First, let's get into the statistics of our class poll. 80% thought that healthcare was not affordable whatsoever, and about 50% of it thought it was due to insurance companies wanting to make a profit. And many claimed that their biggest concern was how much a simple checkup cost. Now let's get into how much healthcare actually costs, because many people underestimate it. According to Shell Adam and Ellen Kennedy, the average cost of healthcare by age and state in 2025 was $684 a month in Illinois, and it's now up to an average of $888, which is a 30% increase in just 1 year. Now let's talk about how much it would cost for a simple 20-year-old like myself to get insurance. It would be $571 a month, and that is an unrealistic expectation for a 20-year-old to pay. Like myself and many other college students, I am full-time in school while working, and I still cannot afford that. And that's for insurance. Now if we get into people without insurance, like myself, for a basic urgent care visit, it's about $200, not including any tests. When I go to the urgent care for something as simple as a sinus infection, I have to pay a minimum of $250 each time, and that's not including my medication. Now, if I were to need to be tested for like strep throat or RSV, or if I simply broke my foot, I'd have to pay an extra. Now let's say they misdiagnosed me. You have to go back, which leads you to another payment, which can put you into even more debt. Now let's talk about annual visits and how much they actually cost. For a typical annual visit, it is about $350 base pay. And that's not including any labs or medication. Or if you're a woman and you need a pap smear, you have to pay that out of pocket as well. And even with insurance, sometimes things are just not covered, leaving people stressed and unaware on what to do. Now that we're aware of the price, let's talk about the negative effects. According to Raymond Byland, Making Healthcare More Affordable, December 16, 2026. Rising costs create a risk for people to face catastrophic healthcare situations that could lead them into mortgaging their house or even filing bankruptcy, which can be very hard on people's financial and mental health. The lack of healthcare being accessible can lead to illness, outbreaks, and higher death rates. People without insurance are more likely to skip their annual visits, making it to where things that could easily go detected, like diabetes or cancer, other underlying health conditions that could have been easily found and treated if healthcare was simply more affordable, to more serious conditions and even sometimes death. And if we get into the mental health aspect of it, people that struggle with mental health tend to need therapy or medication. And if they don't have insurance, they cannot get any of that need. And if, let's say, they were suicidal and they felt like they needed to go to the mental hospital, that would leave them with hundreds of thousands of dollars in debt. And sadly, the people that are most affected are uninsured and the middle class, as middle class typically doesn't qualify for help, but most of the time don't make enough for private insurance. So now that we know why things need to be more affordable, this is how things can change. I made up some solutions that could be either universal health care paid by our taxes, which we already pay, and majority of the other countries have that already, and they're just fine, as well as price regulation, or even simply a realistic expansion on Medicaid. The limit is $1,300 a month before taxes. Now, if we think about it, the average cost of an apartment, a simple one-bedroom apartment, is about $1,500 a month, up to $2,000 a month. So you're left facing if you would rather have health care or basically live. And another way is to simply just spread awareness, make people know how important it is to have health care. Now, with all the evidence, it is clear how urgent the need is for more affordable health care. No one should have to pick between feeding their family or their health. Healthcare is a necessity, it is not a luxury, and change starts with us. That's whether you meet with policymakers and express to them why they should make healthcare more affordable, or simply supporting organizations that are dedicated to healthcare reformation. And now I have some pictures that I would like to show. This picture is how much the average person spends a year on healthcare. So back in 2014, it was $16,000 a month. And now in 2025, it is $26,000 a month, almost 27. And that jumped up $10,000. And if you think about it, that's someone's basic salary sometimes. That's a minimum wage job. And this one is how much they've changed. This is the compound effect on how high healthcare increases, means that by 2026, the healthcare costs are projected to be 62% higher than they were in 2017. And this is for insurance through jobs and how much they pay. So the light blue is employers and the dark blue is workers. Jobs. As you can see, the light blue covers majority of the insurance. And this is how worried typical Americans are about affording things for their families. For healthcare, it is the highest worry, with 32% very worried and 34% somewhat worried. And that is my speech. I hope you guys all enjoyed, and here's my audience.